kind of the idea of back when we were young and powerful and sexy and shiny and new when we were teenagers, we were in our 20s. And I kind of think of, we kind of were like Ferraris, you could, you were just, powerful, sexy, whatever, you could just run through, you were fast. You could, if something came along, if you were driving on a street with a bunch of potholes, didn't matter. You can go through there and just power through everything. And that's great for a little bit. But the thing is, what we kind of forget sometimes is if you take, your Ferrari and you are running through potholes and you're just constantly going on a road and on a path that has a bunch of bumps along the way, and you don't do anything to address those bumps in the road, or you don't take a different path, or you don't do something to fix that, what's going to happen? Okay, the Ferrari starts to kind of break down a little bit, gets some some little rattly noises, start to leak a little bit, and maybe in more ways than one, but leaks power, and pretty soon it's like you're not the Ferrari you used to be. And the thing is you can go and you can fix all those things on the Ferrari, but then if you get back on that road again and have the potholes, we're kind of going through the same thing. So what I like people to think about is going through when we're doing our workouts, a lot of times people back when they were young, they could power through, they could go. And I'm going to just mute everybody here because there's a little background noise on my end. You could actually, there we go. You could power through, you could power through, you could kind of go through, and yes, you could get the thing done. You could lift the weight, you could swing it over your head. But once again, it's like those sort of faulty movement patterns, those little things that you might have done, maybe you had a little injury here or there, which made you kind of go in a little different direction. So you started losing the most direct path in your brain to get the most efficient movement. And so when you lose that efficiency, like I said, you're kind of taking the detour, or you decide to just go ahead and just run right through the detour, run right through those potholes, that's where you get the breakdown in the body. So what I am inviting you guys to think about is the fact that when we work out, we've all heard the term, you want to work out smarter, not harder. Well, I got some news for you guys. As we get older, we start losing muscle mass like 3 to 8% per decade. And it really accelerates when we get over the age of 60. So the reality is actually you need to work out not only harder or smarter, but you also need to work out harder. But the problem is if you go back to trying to run your Ferrari through the potholes, you're going to run into trouble. So what we need to make sure that we're doing is kind of going back and slowing down enough to where we can fill in the potholes, where we can actually start going back to the motor patterns of our brain to make sure we're addressing kind of how you're getting from point A to B. And then from there, once you smooth the road out, once you smooth the path, once you smooth that motor pathway in your brain, now you can add speed and resistance and power to those exercises. But if you try to do it beforehand, that's what will get people in trouble. So that's kind of what I want you to think about. And I like to tell people, we work out the body, but we work out the brain, it just happens to be attached to the body. And we know that doing exercise has such a positive effect on the brain. The thing is that if you are having anything where you're in pain, if you're having stress, the brain is not going to necessarily want to learn how to do a new skill. It's not going to want to be able to become more efficient at that skill. It's going to be going into survival mode. It's going to be saying, hey, you know what? Something's not right. I'm in danger. And so you're not going to be in that position to properly learn how to do things. So this is important because you want to think about this as you're working. If we know that exercise is a form of stress relief, but you've got to consider the type of exercise you're doing and when it's happening and what your mental state is, because the brain cannot differentiate between stress and pain. If you have a little faulty movement pattern because of pain and you're stressed out, you're probably going to have that same motor pattern. The brain's kind of like, I don't know the difference. And if you're stressed out and you're thinking there's danger, there's something happening, like I said, if a saber tooth is coming after me, I'm not going to be thinking, this is a great time to learn a new skill. No, I'm going to want to be moving as fast as I can. I will get out of there. I will make the movement as fast as I need to. But will it be the best for me? And will later on I be sore because actually I did something I shouldn't have? So these are the things to consider, just even from a mental standpoint of just your state of being and where you're at. Now, one thing that I love to do is to kind of break down myths, a lot of myths, because I think probably one of the most common questions that I get asked as a physical therapist, and I can be anywhere. I can be at a party, I can be a social gathering, and I'll get this typical question of like, hey, Ada, oh, you're a physical therapist, awesome. You know what, I'm always really tight, name the body part. Can you give me a quick stretch? What's the best stretch for that? And I just want to start with one myth here. And myth number one is that stretching, particularly stretching before you exercise, people think that it will help reduce your chances of injury. Studies say, no, they do not reduce your chance of injury. And in fact, in some cases, stretching before exercise can actually increase your chance of injury. But there are different types of the ways we stretch. And what I want you guys to think about is when you feel like you need to stretch something, think about why we stretch something. I mean, if we take a rubber band, we take anything and we try to stretch it, what's happening? We're trying to make it longer. All right. So the assumption, if you are going to stretch something, you have something that's shortened, and we're trying to create some length. Now, in the body, and a lot of postures that we tend to assume, and if you have the typical office bod here, where you're sitting all day, your poor hip flexors are super tight and they're in a shortened position, and your neck extensors are in a super short position, and your back muscles are in a lengthened position. Yeah, we've definitely got some areas that over time are sitting there and they're chronically in a shortened position. But I want to step back for a minute and have you guys think for a second about, is it really that a muscle is tight because it's too short? Or is it feeling tight because it's taut, because it's actually engaged, because it's firing and it's doing the job of somebody else? Now, I don't know about you guys, but has anybody ever called in sick? And you have a couple people calling sick, and suddenly you're the person doing the work for 3 people instead of you just doing your own job. And it's a little bit crazy, right? Because you're trying to do everything, and you're not necessarily, you're kind of doing it for a while, and then things get out of control, and pretty soon you get cranky and you're just kind of like, forget it, right? Well, the poor muscles in the body kind of have the same sort of attitude. And so a lot of times when you have that muscle that's taut, that is a muscle that's probably working too hard, because who should be working, that muscle that should be doing the work, is not kicking in. And if we can determine what's not kicking in, that usually helps us to be able to then, if we can kick in the muscle that's not working, then we can let that other muscle, it'll let go. And so with that, we can actually get a little bit more balance in the body without necessarily stretching. And we'll do a little bit of this. And some of these things that I'm going to show you, the good news is that this is going to be recorded, so you can go back to this later on. But you can do some of these little movements and exercises with something, with just like simple resistance bands sometimes, even sometimes the resistance of your own body, to be able to activate something. And like I said, we'll go into this a little bit more. So that's a concept to sort of think about. Now, when you're like, well, Ada, I'm not a physical therapist, I don't know what should be working and what's not working. And so I like to kind of give people a little mini anatomy lesson, not so much like you got to know all of these bones and all the muscles. I mean, they've got these things that are painted so you can see where everything attaches and all that. I want you guys to kind of remember 3 things. And I tell people, to have fun in life, you need 3 things. Well, you need a few more, but these 3 things are a good place to start. You need a beer can, you need your Dos Equis, and you need a 6-pack in that order. So we're going to talk about the beer can, which is the core, the Dos Equis, 2 X's, which is in Spanish, but of course, the 2 X's are these functional relationships of muscles. And then your 6-pack, of course, everybody always wants a 6-pack. They want the core, and they always, we hear that, hey, if you have a strong core, everything works better. And I'm going to bust the myth that it's not a strong core, but it's actually core control. So let's talk about these three elements here. And so we'll talk with the one that actually for me is the least important. And quite honestly, it's there, it has its function. Yes, we need it, but out of everything, it's kind of the thing that people tend to work on, but it's not the most important. That's the six pack, right? Your rectus abdominis. It's the most superficial group of muscles in our abdomen. Those are the ones when you're doing like your 10,000 crunches, you're working those. Now, the thing is that if you're trying to do more core work so that your back feels better and all you're doing are like 10,000 crunches, you're not gonna experience that. It's not gonna work. It's a very superficial muscle group, and it's not designed to necessarily create control and stability around the spine. Our spine, we've got a lot of vertebrae here. You've got 7 cervical vertebrae, so those are your neck vertebrae. You've got 12 thoracic, and you have 5 lumbar. So you have all these little vertebrae stacked on top of each other, and they've got these kind of cool curves. Now the thing is that why do we have all these little vertebrae? Why aren't we not just one single rod that just kind of moves around? And we could be. I mean, you could say, well, yeah, so we can actually have this freedom of movement in all different directions. That's great. But the problem is that if you are doing things where you're in sustained positions, okay, for long periods of time, everything is kind of just creeping there and kind of getting stuck and stiff there, what happens is that you no longer have this beautiful distribution of force that really is the reason why we have the curves in our spine and we have these separate different vertebrae. The idea is when you go to move over here to one side, I'm not just hinging and shearing at one spot. I am actually getting like a couple degrees of motion at each little vertebrae so that when I go to reach for something or when I'm reaching overhead or I'm doing whatever I'm doing, because guess what? Life happens in spirals. It doesn't always happen here when you're at the gym doing things in this direction and everybody's doing all these things in these very straight line directions, but life happens here, right? Life happens in spirals. And so the thing is that if you are not getting those little couple of degrees everywhere and you have a chunk of your spine, so a lot of people are very stiff in the middle part of their back. This middle part of the back is where we should have the most motion, where we should have the most mobility, particularly in rotation. That area is designed to rotate your spine. However, if you can't rotate there, that's okay. There's some other segments down below, but the problem is we've now held this area as a chunk. So now instead of having that rotation occurring between 12 vertebrae there, it's now kind of held as a chunk, and now you're going to start getting a lot of shearing at kind of the TL junction, which is where everything kind of comes together, and oftentimes down at L4, L5, L5S1, the lowest part of the back. So it's just simply, people think that they are stiff and that's what needs to be able to, they need to get more movement there, but the problem is you get degenerative changes because you're moving too much there and you're not getting the movement in the other parts of the spine. So going back to our six pack, if you have these muscle groups that are crossing over several joints, those are mover muscles. Their primary function is to move, all right, which is good. We need to be able to move. But the deepest layer, our beer can, which I'll describe in a minute, our beer can is designed to stabilize, because the beer can is basically, it's kind of our inner cylinder, and that's what I consider the core. If we were to take the six-pack muscles and just cut them away, throw them away, then we have our oblique muscles. You have internal and external obliques that are sitting at the abdominal wall. If we cut those away and we go to the deepest layer, we have this layer of muscles that goes in a transverse direction. So hence the name transversus abdominis. Those guys interdigitate with these little tiny muscles of the spine that just kind of go segment to segment, called the multifidi. So the beer can, the edges of the beer can are essentially the transversus to the multifidi that are basically helping to deal with these fine-tuning little movements segment to segment, so that when you do move over here, they're kicking in and saying, oh, I can control that, right? Now, you have a top and the bottom to the beer can. And the top and bottom are your pelvic floor and your diaphragm. So the diaphragm is essentially your respiratory muscle. It happens to be attached, by the way, to your spine. And your pelvic floor muscle, well, you know, your pelvic floor is down there. That actually has a very important function working with the rest of the core. So the problem is if there's dysfunction in how you breathe, if there's dysfunction in how that's moving, that affects ultimately how well your core can control things. An interesting tidbit, like a lot of people, like they may use running as their exercise. And they're, you know, they're trying to improve their cardiovascular health, and they're out there, they're running. They get out of breath really quick, and so I got to run more and more and more. What's interesting is that the diaphragm operates as both a respiratory, as a mobilizer. Every muscle in the body has can mobilize or it can stabilize. So if the diaphragm is acting as a mobilizing muscle, it's breathing. That's what it should be doing. Okay, that's its primary function. But if it needs to stabilize, if it needs to be acting as a stabilizer because of its attachments, that's going to impact how you're using it to breathe. So you're not going to breathe as efficiently. So sometimes people who are inefficient and, you know, they're not able to improve, you know, hey, I get winded every time I've been training, I can't get better. We actually need to look at how well they're stabilizing so that they're actually releasing the diaphragm to be able to let them use it as the respiratory muscle. So just fun fact over there of, once again, sometimes we need to think about, are we working out harder in the right way? Are we working out smarter? Do we need to come back to the beer can, come back to the core? So we've got those deep core muscles way in there. Okay, so what are these dos equis, these two X's? What the heck are you talking about, Ada? Well, this is where Harry comes in. So Harry makes it easy to see this. So we've got the stabilizers, but if we want to do movements, and I've talked about our movements happen in rotation. You might be a golfer. You might reach for something in the back seat of your car. You're fastening your seatbelt. These things are happening in diagonals. The way the muscle relationships work with muscle attachments and with the fascia, which is kind of like this kind of this connective tissue that kind of runs head to toe, we have essentially these relationships of these muscles where your inner thigh muscles are interrelated with your internal obliques on one side, the external obliques on the other side, and a muscle called the serratus anterior, which is a super deep muscle, but attaches onto the underside of the shoulder blade. Huh, interesting. Your shoulder blade has an effect all the way over on this leg, okay? So you've got that on both sides, so there's the front X. Oh, but let's go to the back side. From the shoulder blade, your lats have an attachment into some fascia, which is the connective tissue in the back, and it comes over into the opposite glutes. So you've got that on both sides, all right? So Harry has, there's his back X, okay, into the glutes coming off, well, this isn't exact, but your muscles would be coming off of the lower, attached onto the lower part of the scapula. So you've got these two X's, and what is in common with both of them is that both X's are having an effect of how the pelvis stabilizes. And the pelvis, if you know where that's at, you can stack everything on top of it. So the shoulder blades and the pelvis work really closely, they're interrelated with each other. So if we ignore the fact that these guys are working together, and you're just trying to work things in single planes, you're really missing how your workout can actually translate into real life. You might be stronger than you know what doing your bicep curls right here, all right? But you go outside of it a little bit, and the rest of your X's are not able to help you with being able to generate power or being able to generate control to help out your beer can, okay? So what I want to do is just kind of let you guys sort of think for a second that it's not just individual muscles. When somebody asks, like if you're doing a squat or you're doing something where you're standing on one leg, I don't care what muscles, what one muscle and kind of, what is this working, Ada? It's kind of like everything is working. When you lift up an arm, the very first thing that fires, if you don't have low back pain, very first thing that turns on is your deep abdominals, and then your arm floats up. If you have low back pain, guess what's the first thing that fires? Your arm, and then your stabilizers down here. So it's the sequence of how your body is kicking in, how the beer can, the two X's, and finally the six pack are working together. That's going to be, those are the things that we want to make sure are really kicking in. So as we're looking, and I know I'm kind of talking quickly. I'm going to talk quickly so we can actually get some movement in, and I'll take questions here at the end. But I wanted to kind of sort of get into one more other thing where I talked about the brain has such an effect of what we're doing, and you know, when you go to the gym and you're working out, you're not just working out muscles. And I already alluded this to the Ferrari. You're working. We need to work on the pathway of how you're getting from point A to point B. What's happening whenever you're taking a step? And the thing is that we already talked about if you have pain, your brain is kind of getting a signal that something's happening here. sometimes you might get pain, not because there's anything necessarily dysfunctional or there's a lesion, there's anything wrong there. Sometimes you're getting a pain because you've had an injury in the past and you are anticipating that there's going to be pain. Pain's a very strange thing. It's you know, people who have chronic pain, you know, they all want to go get their MRIs and this and that, and they go get an MRI and the MRI says, oh, you've got this, that, and whatever, moderate to, you know, severe, degenerative, blah, 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 blah. And, you know, guess what? If you actually went and took an MRI of like 90% of the population that was like your same age, they would all have, you know, the same stuff. The question is, do they have the same pain? No, because pain is kind of a complex emotion. It actually has a very, very interrelated relationship there. And so sometimes, so we do have to respect pain and to recognize that it's there. You don't want to push through it thinking, oh, this is all in my head. Well, it is in your brain, but it does affect how you move. And the idea is being able to introduce to your brain different options for motion so that you're not getting stuck going down the same road every day. And when there's suddenly construction zone there, you have a way to be able to move around. And here's the thing. It's like if you've been doing something a certain way for 10, 20, 30, 40 years, think about the last time you might have tweaked your back, tweak your knee, tweak whatever body part, you know, and it's like, okay, that got better. But it's like, I don't know if anybody's ever sprained their ankle and they find themselves like a couple weeks later, they're still kind of limping a little bit, but they really, you know, the ankle's fine. But they're still kind of, their brain's still in that pattern. You can carry those patterns with you for a long, long time. And unless somebody picks them out or unless you're able to see them in yourself, that's gonna, like I said, start leading to the breakdown. That's the path, those are the potholes. So the question becomes, when you're working out, you know, we talked about you've got to work out smarter and harder. Well, we already said, if you work out hard and you're going hard and fast, is that going to be the best path to get you to the next place? Or are we going to look at how can we slow down for a moment and really see if we can fill in those potholes? That's going to be a factor of doing things that actually work on the control, work on sometimes the slowing down of how muscles work. So if you think about a jump, we don't usually, most people don't get injured on the way up. They get injured on the landing. They get injured on the way of how they control. So the control element is really, really key. So with that, let's have everybody, because you guys have been sitting down listening to me, let's everybody just stand up for a second and just stand up. And we're going to talk a little bit about control, and we're going to talk about kind of what things to think about when we are working out. So I know this is a lot of stuff. I'm trying to break down kind of how, let me break down my doctorate of physical therapy in like 45 minutes, you know, that works well. But I want you for a second to just stand here and let's pretend for a moment that you're holding two feathers in your hand, feather in each hand, okay? And I want you guys just to allow your body just to kind of rotate sort of one side to the other. If you got any knee issues, don't rotate too much so your poor knees don't hurt. But I just want you to kind of feel what's going on in your body, okay? It's okay if your feet decide to roll. Just pay attention, okay? Sometimes we don't spend enough time paying attention to what we feel in our own body. Do you spiral to one side a little easier than the other? Does it hurt when you go to one side? What do you feel, okay? Now, I'm gonna go ahead and let's have you sort of stop back in the center again. Now, instead of these feathers, I want you to pretend now you're holding onto these two like large, maybe gallon jugs of milk. So a gallon in each side, all right? Let's go ahead and do that same spiral back and forth, but now you're holding the gallon jugs. Do you guys feel that you're moving differently? Okay, do you feel that, hey, my abs turned on? You didn't hear me say engage your abs, but they naturally, your body anticipated what it needed to do for the load it was going to get. Your body, when it's working properly, when it's working efficiently, it creates the anticipated amount of, the right amount of stiffness, and the stiffness being stability for the anticipated load. So the gallon, we know that we've got to have a little bit more engagement when we're flipping around the gallon jugs than when we have the feathers, right? So for example, let's stop now. I don't know how many of you guys have ever been in an exercise class. Next time you do go or join or listen to an exercise class, listen to your teacher. And those teachers that will cue muscles and they cue individual muscles, I have a problem with that. And why I have a problem with that is because I've already told you it's not just one thing that kicks in, it's everything. It's the anticipation that creates the right amount of stiffness. So I'm going to have you guys feel this. Now, let's hold on to let's hold on to our feathers again. Okay. All right, go ahead and engage your abs, tighten your abs, whatever you want to think. Okay, so tighten the abs. Go ahead and rotate again with your abs tight. Kind of feels not so good, huh? Feels a little crappy. All right, now you got the gallon jugs. Tighten those abs. Might even feel worse, right? And come back. You didn't feel the spiral of ease that you did when you weren't thinking about tightening your abs and you just let your body do what it needed to do. So this is the thing. We need to make sure that you're not over cueing things. You're not telling something to fire more than it has. Now, if I'm going to pick up this huge weight, I do need to engage a little bit more, but I have to think about, is telling a person to tighten going to be the thing that's really going to be the best way to get them there? If I have a golfer who's got to be able to have movement and power in a swing, and I tell them to tighten their abs, they're going to tear up their low back because their poor little spine is not designed to rotate. Should be rotating in the middle back, but they're going to be holding everything tight and they're going to get a ton of shear, a ton of compression. So that's just kind of a nice little way to sort of think of what's going on. Let's go ahead and sit back down again. So just for some practical stuff that we can start to experience here, I'm going to show you what you can do with like a resistance band. And these are really cool. These are like $5 online. I mean, you can get these little resistance loops. A lot of you may actually have a resistance band lying around that you can actually tie in a loop. You can tie it just around your legs. If you don't have one, and you probably didn't bring one to this class, that's totally fine, but I'm going to show you what we're going to do. If you don't have one, we can actually utilize your hands as a little bit of our resistance, okay? So I'm going to show you with the band. I'll also kind of mimic with my hands, and I'll cue it with the hands, but like I said, you can go back and replay this. So, when you're sitting down at a desk for a long period of time, we already talked about that, the hips get stiff. The problem is the way the body works, we should have this alternating mobility and stability at different parts of the body. If we start from the feet and we think about with walking, you've got to be able to have mobility at the great toe. You have the arch. An arch should be stable, right? That's what you have bridges that are arches. The arch should be stable. We should have mobility at the ankles, some relative stability at the knee, mobility at the hips, stability at the low back, mobility at the middle part of the spine, and kind of on up. So it kind of alternates. The problem is when you have something that's stiff that should be mobile, it'll transfer that mobility up to the next segment. So all your spins and glides in the joint that should happen down low get transferred up to your knee. So once again, your degeneration doesn't happen because there's no movement. Degeneration happens in the knee because there's too much shear. There's too much of this going on, and it's just rubbing and irritating everything. And oh, by the way, when this is going all over the place, the hip that should be mobile says, whoa, hold on, there's something going on, and it stiffens up to try to control all the motion. But we already know the hip should be mobile. So then if it's not mobile and it becomes stiff, the low back starts to get a little bit crazy in rotation, and it's not designed to rotate. So everything can get really shifted, really, really ugly. So I talked about how, so if we want to have some looseness in the hips without necessarily stretching them, what you can do is, and this is not the most, this is great for home. This is perfect for this series because you're not sitting in an office, maybe a couple of you guys are, but if you're someplace where you're not flashing somebody across the way, you can sit with your legs wide with a resistance band around the outside of your legs, okay? Sitting kind of tall on what I'll refer to as your sit bones. Essentially, those are they're called ischial tuberosities, but they're the two bones that essentially when you're sitting on them, your body is really stacked on top, okay? Now, if you don't have a band, you can actually, I'll put this down for a second. When you've got your legs out here, you can actually just push out against the outside of your legs, okay? Just so that you feel a little bit of that resistance. All right, so you can push out there, and then what I'm going to have you do is keep that pressure as you let those knees fall inwards, and you can let up on the pressure as you bring it back out. So I'm just going to have you guys just allow yourself to resist the knees coming in. And just as a disclaimer, if you've had a total hip replacement that was a posterior lateral approach, hip internal rotation is contraindicated unless you've gotten clearance. So just letting you know that. Get all of my disclaimers out of the way. All right, so we're just resisting those knees coming in. Keep going. If you want, you can resist on the way out as well. So you can put your hands on the inside and just kind of resist both directions. Just keep going. Just resist both directions this time. We'll do that a couple more times. And then now let's just hold it out there. Now let's just focus on one hip. Now, this is really great when I have a single band. I'm going to slowly let that leg go in, and then I would allow it to come back out. So those of you guys who don't have the band, you're just going to, once again, you're just going to be pushing against one hip at a time, and then letting it go back out. And actually, let's go ahead and just keep resistance on the other one. So one is staying stable and one is mobilizing, okay? When you are walking, one leg is stabilizing, one leg is mobilizing. And I'm just keeping that resistance. I'll do a little bit on the other side as well. So we're going to slowly let that leg fall inwards. We're resisting it and back out. And oh, by the way, we're doing this. We're working your hip rotators. Yeah, we are. Let's keep going. And I always say, if there's anything that hurts, stop, even though I said to keep going. All right, respect your body. Because you may be having things going on that I don't know about, and I'm just teaching a class. Okay, let's go ahead and just bring those legs back in for a second. I'm going to take my band off of there. But I want you now just to kind of let them move around. And they should feel like there's a little more motion here. Now, doing it where you're resisting with your hands is different than the band. I do encourage you to go grab a loop or whatever, tie a loop of band around your knees and feel it. And it's like, wow, my hips are they feel super loose. Did we stretch something? No, we didn't stretch something. We activated something. We activated something and it let something else let go, okay? So let's kind of think about, a lot of people are super tight in the hamstrings. Now I can go here and I can get some pretty nice hamstring stretching and it feels fantastic. You know, stretching, it's not that stretching is wrong, passive stretching is wrong, it's great, it's like scratching an itch. But the problem is if we stretch something and the brain doesn't know what to do with that new motion, you're going to go right back to the same old pattern you were doing before. You've got to teach your brain what to do with the new motion. It's got to be able to use it. So if you did have a band, I would have you put it up against, right up over your knees again. If you don't have a band, once again, you can just place your hands on the outside of your legs just for a little feedback here. Scooting to the edge of your chair, and this is something, you know, if you've got a chair that's got wheels on it, I would probably, I wouldn't do this right now, but if your chair is steady on the floor, then on the ground, you're fine. And what I want you to do is scooch to the edge, and I want you just to hinge forward for a minute. Hinge more forward than you need to be. Now that's different from spine flexion, which you shouldn't do if you have low bone density, but you can go ahead and you can just hinge and back up, okay? And I've just got this band here, so I'm just hinging back and forth. You can have your hands on the outside going back and forth. Now, let's take a moment to relax. We're gonna think about those sit bones again. So those sit bones, interestingly, what happens when you go from this flex position of your spine, you're sitting, to standing, when we stand, those sit bones come together, okay? And that's just because of how the pelvis works, okay? So the sit bones, in extension of the hips, those sit bones come together. When you sit down into a chair or you do a squat, those sit bones come apart. Now, people, when they end up with back pain, a lot of times get in trouble here because they're guarding so much. And so they're trying to they're guarding so much and they're holding engage your abs, and their poor sit bones, even though they're going into a squat, are staying closed. And that's biomechanically not how the body works. It has to open. And so it may feel kind of weird if you're at work somewhere, but you're at home, we can do this. If you guys all stood up again, everybody stand up, okay? Put your hand on your rear end, okay? Stick your fingers right where you can find the fleshy part, and you're gonna feel your sit bones. Boop, there's two bones right there, all right? Pretend you're gonna sit into your chair, or start to sit into your chair. Feel how those sit bones, and if you're really pushing up, you're gonna feel them widen, okay? And if you don't feel them widen, pretend they're widening, and then come back up to standing, those sit bones narrow, okay? So they widen when you go down, they narrow when you come back up to standing. So this is biomechanically how things work. All right, now let's try for a second. Now you know where your sit bones are. If you keep those sit bones closed and you try to sit in that chair, you feel how terrible that feels? And you come back up. It's hard, there's a lot of extra work going on. It's not happy. But if you open the sit bones, if you allow them to go, that's easier, your body is now working efficiently. So let's come back down into the chair. By the way, if they're gonna put you into a rest home, it's not because you have weak arms, it's because you have weak legs. That's why I like to work on the lower body. All right, so if we scoot forward into the chair, we're gonna go a hinge forward. If you're hinging forward, those sit bones are widening a little bit more. We can take your hands on the edge of your chair. Once again, if you're on a rolling chair, don't do this, but just take them and hover yourself so that now you're putting your weight on your legs. If you've got some knee issues and you can't handle this, don't push it. all right? But just come back down. All we did was shift your weight, okay? So we're hinging forward, the sit bones are wide. We're gonna hinge forward, place the weight on your legs. Now, okay, what happens if you take your hands away? Can you hold that? Awesome, great. Let's go ahead and sit back down. So just by doing this, gosh, if you do this a little bit, this is great. You're actually working a little bit on some of the strength, some of the control kind of down in the lower body when you're down at a squat, which our society does not squat enough, okay? So let's go ahead. We're gonna bring it to that hover position. Now, the sit bones are open, but we're gonna come to standing, which means the sit bones are gonna close. Whoop, so close the sit bones. All right, now we're gonna go ahead, open the sit bones and go back in the chair. Whoop, they're gonna open. And back up, they close. So if you think of what's happening in the body in terms of what goes on with the bones, instead of being obsessed with what happens with each individual muscle, am I working my glutes here? Yeah, I am. And guess what? When my glutes are working, those hamstrings that are always tight and taut, they're tight and taut because they're trying to do what the hamstrings are doing, okay? So, hey, let's do something. Let's do a little something for those hamstrings. Let's go ahead and hinge, widen those sit bones, hold it there, put your hands on your knees and straighten your knees and bend your knees. So nothing has changed. My sit bones are still wide. Once again, this is probably not the best thing to do in the office. Great for home. All right, except for my office here in the Pilates studio. And so now we are getting a dynamic hamstring stretch, okay? So when we talk about passive stretching, is something that can increase injury because your body doesn't know what to do with the new motion. Here we're actively using that stretched motion, so your body is finding out what to do with it. Okay, let's bend, come back up tall, and then let's go ahead. You guys don't have the band, but if you do this, like I said, do it with the band, and just feel when you get up, it's like your legs feel light and fluffy. They're ready to go run out the door. Okay, so we have just done something to basically activate what needed to be activated, and that allowed for mobility where there should be mobility. Now, when we go work out, I'm not going to be working and fighting against my own body. I'm actually going to be in a little bit better position. When I go for a walk, it's going to feel fantastic. Now, last thing I want to do here, because we're running out of time, and I want to make sure that I touch on it. I want to make sure I get any questions from you guys. And that is, what about at the back, okay? A lot of times, and different people hold themselves differently. There are sort of two main types that I see a lot. I see people that they've got the belly that doesn't know how to stabilize in the front anymore. And they have maybe a little more curve in their low back. They might stand like this, where they're just like, I need to stabilize. They will utilize these low back muscles, and that's where they get their stability, okay? Now, there's the opposite group, and I tend to find this pattern generally with more women. You know, a lot of us have had kids and never quite retrained the front side again. And that's my pattern. I mean, when I'm tired, this is where I want to go, okay? I'm human. Now, the other pattern is the kind of flat back. They're all ab pattern. Oh, they're here. You know, the ones that have no butt? Okay, a lot of guys are like this. They have no butt. They're here, walking to the gym. And so the thing is sometimes like, well, how can we facilitate things so we can get them equaled out? This person that stands like this, probably when they get tired, they get a lot of low back, like, oh, this stuff is really, really getting me. The person that's sitting around like this, they might be like, you know, they're stiffer than a board. They're just kind of like, I just can't move. I have no mobility. So this is where a band can also be just a super helpful trick. So I'm going to show you how you can use a band to facilitate and to change some of the motor pattern. So if we take, I call it serving the cookies. We take this band around the lower part of the ribs and we bring the elbows in. And you push your palms out so that now you've got your elbows in. Your palms and your hands are going to about a 2 o'clock and a 10 o'clock position. What you don't see happening here, but if you try this at home, you're going to find when you do this, you've just turned on your front X. You've just turned on the front side of your body. And when we turn on the front side of the body, we allow the back side of the body to take a break. So remember, if something's overworking, we need to kind of turn on something else. So if you're trying to hold yourself upright, we need both sides of your body. We need dos Equis kind of helping to keep everything up. So sometimes for these people that when they're trying to do their open the sit bone down to the chair, and I see this big sort of substitution and they got the butt way out here and they're stabilizing from the bottom, they need to get their middle back in there, or they need to get their abs in there. So guess what? I have them serve the cookies as they sit down. And without me saying tighten the abs, they're actually tightening their abs, okay? They're actually getting the amount of stability they need to have. For the person that's here, it's like, oh my gosh, they're there, right? They need a little more extension. So by holding the band and pulling apart, this actually encourages the backside of the body. So now they're actually able to stand a little taller and they're able to access now the glutes that before that were underneath them. So it's just interesting how you can utilize simple tools to turn things on, turn things off, get the body to kick in when it needs to kick in. And it's not by necessarily having to consciously think about, I got to tighten this, tighten that. It's about actually creating vectors of force that enable the body to do it because it has no other choice not to. And that's the type of thing that I do in our programs in Be Well, Stay Well. It's an online exercise classes that we have that are live. We do that. It's what I do here in the studio and all of our physical therapists and Pilates teachers do. We teach people how to recognize what's happening in their body. And when you know what's going on, when you can feel it, when you can experience it, and then you understand it, it's so much better than to know what things you might be doing that are working against you and what things you're doing that can actually be working for you. So with that, I'm happy to take any questions, and hopefully that kind of gave you a little bit of an understanding of how the body works in like 45 minutes. And if there's any questions, I'm super happy to answer anything. And you can unmute yourselves or put something in the chat if you have anything.
I actually have a question, but I don't have time because I have to run. But what if you carry the stiffness in your back like behind your shoulder blades?
Mm-hmm.
Like I've been walking a lot, and that is the place where I feel it.
Right. Well, that comes down to, we actually got to look at what the shoulder blade and the thoracic cage is sitting on top of. So we can't ignore the pelvis. How the pelvis, you know, when I talked about the beer can, the Dos Equis, and the six pack, that a lot of times is related to how your body has to stabilize every time you transfer weight, every time you take a step. And so if that's not efficient, you're going to be using a lot of other things to create that stability. So we talked about how those stabilizers of the pelvis are attached to the shoulder blades. So does it surprise me when I see somebody who comes in, I'll ask them what's going on, and they'll say, my right hip is bothering me. Or they'll say, my left shoulder is bothering me. Okay, so let's say they say my left shoulder is kind of tight, it's icky, it's whatever. I bet you, I could predict it. I won't say anything, but I'll test it, and I always find it, is that they've got something going on one side, and I'm going to find something on the opposite diagonal that's the issue. So what do I sometimes treat? I treat here. I don't even touch the shoulder. And they're like, why the heck are you doing stuff at the hip? I'm like, trust me, it'll work. And we do our voodoo down here. And all of a sudden they're like, oh my gosh, my arm feels great. That tension went away. Mm-hmm. And it's because sometimes, like I said, sometimes a person can have weakness on the left glute and their opposite shoulder is kind of coming down and it's depressed because it's trying to stabilize and it's trying to help out what's going on. But oh no, now this front part of the X is all expanded and it's not coming in to help out. So it's finding these balances of the X's and understanding that. And that's why I said it's so complex. It's so much fun, but it's kind of crazy. And it's just hopefully something to think about, because it's usually not how people are thinking when they're working out. They're just thinking, hey, what muscle can I work? And not necessarily why. It's always about your intention. And I think that's really important.
Thank you.
I love it. So reading in the chat here, my hands and shoulders hurt because I play my iPhone and video games. Any way to help me? Yeah, a lot of text neck where the head is forward and you're sitting like this. You know, for every, like if you have your head tilted down at 45 degrees, it's like actually your head on top of your spine weighs 13 pounds and 12, 13 pounds. That's about a bowling ball. And if you come down to like 45 degrees, it now weighs like 45 pounds. So it's really kind of crazy. For every degree you're going down, how much more weight these poor little muscles in the back of your neck and the back of your shoulders have to now hold this bowling ball. I always tell people, if you had to hold a bowling ball out here all day, your shoulders would be talking to you, right? So that's what's happening to these itty bitty muscles back here. So a lot of times people, when they're doing stuff with the tech, you know, they got bifocal glasses, they actually end up having over lengthened and weak neck flexors, which I call the abs of the neck. And they have overworked, over tight, shortened the back of the neck muscles, some of the suboccipital muscles. Those can feed into headaches and all sorts of things back there. So oftentimes, once again, I won't necessarily tell them to stretch their neck. I'll put them down. I'll show them exercises to actually work the super deep neck flexors. And it's literally, they're not fun. They're not easy. They don't hurt. It's just they're hard. And you tuck your chin and you just lift up your head for a little bit, just a couple inches, not even an inch. You lift it like a millimeter. And it's like you realize how heavy your head is. And when you actually can get those guys to kick in, I said, now sit up again, now turn your head. And they're like, oh my gosh, it feels looser. Did I stretch something? No. Did I activate something? Yes. So just something to kind of think about there. All right. And so anyway, so with that, I know our time is up here, and I know people have got to get back to their other things. Next week, and I'm gonna butcher her name, so I should have David say this, but next Tuesday, we do have a holiday, so next Tuesday we're gonna have Bindu Garapate. Hopefully I'm saying that right. I'm gonna be talking about Zooming to be exclusive, so definitely make sure you tune in for that, because this is a whole series, and hopefully you guys are really appreciating kind of some of this great content, these speakers that are coming out here. So I thank you guys for your time and for coming and joining me. And if you do want to find me somewhere, bewellstaywell.net is where I have a lot of my online programs. Feel free to go on there and check things out if you want to know. And I'm on YouTube. Go to Pro Balance TV or just search Ada Wells on YouTube. You'll find a bunch of these videos where it talks about these same concepts. But I know that we'll have the recording for this, and you can go back and try those resistance band exercises with the recording and see how those feel.
Thanks so much, Ada. It was terrific.
Okay, awesome. All right, you guys. Thanks so much for joining me, and we'll see you guys next time.